Most strokes don't begin with something dramatic. In many cases, the earliest warning signs are subtle, easy to miss, easy to ignore, or easy to explain away as something else. A moment of confusion, a slight weakness on one side, a brief loss of balance. And because these signs can come and go quickly, many people don't realize what's happening until it's too late. But here's what's important to understand. Stroke is one of the leading causes of serious health complications after the age of 60, and in many cases, the body gives early warning signs before a major event occurs. Recognizing these signs early can make a life-changing difference. In this video, we're going to walk through some of the early stroke warning signs that are often missed, especially in seniors. These are not meant to alarm you, but to help you become more aware of what your body may be trying to tell you. And if you find this kind of information helpful, take a moment to subscribe. This channel is here to give you simple, practical health guidance to help you stay informed and in control as you age. Also, let me know in the comments where you're watching from. My name is Dr. Amba Carter, and I'll be guiding you through this today. Now let's begin with one of the most important and most commonly overlooked early signs. Sudden numbness, especially on one side of the body. One of the most important early warning signs of a stroke is sudden numbness or weakness, particularly on one side of the body. This can affect the face, the arm, the leg, or even all three at the same time. Now, this is where many people make a critical mistake, because the sensation can feel mild at first. It may not be painful. It may not feel urgent. You might simply notice that one arm feels slightly weak, or that your leg doesn't feel as steady as usual. In some cases, people describe it as a tingling sensation, almost like when a limb falls asleep. But here's the key difference. This sensation often affects only one side of the body, and that's what makes it important. You might notice that one side of your face feels different, or that when you try to lift both arms, one feels weaker or begins to drift downward. Sometimes, the change is so subtle that others may notice it before you do. For example, your smile may appear uneven, or one side of your face may not move the same way as the other. Now, why does this happen? A stroke occurs when blood flow to a part of the brain is interrupted. When that happens, the brain cells in that area don't receive the oxygen they need. And because different parts of the brain control different functions, the symptoms depend on which area is affected. When the area controlling movement is involved, it can lead to weakness or numbness, often on one side of the body. Now, here's what makes this especially important. These symptoms can come on suddenly, and in some cases, they may even go away after a short time. But that does not mean everything is fine. Even temporary symptoms can be a warning sign of a more serious event. That's why medical professionals emphasize the importance of acting quickly. If you notice sudden numbness or weakness, especially on one side, it should never be ignored. Even if it feels mild, even if it goes away. Because time plays a critical role in how a stroke is treated. The sooner it is recognized, the more options there may be for care. The key takeaway here is simple. If one side of your body suddenly feels different, weaker, numb, or less responsive, treat it as a warning sign, because your body may be signaling that something serious is happening. Confusion or trouble speaking. Another early sign of a possible stroke is sudden confusion or difficulty speaking. This can appear in different ways. You may find yourself struggling to form words. Or you might know what you want to say, but the words don't come out clearly. In some cases, your speech may sound slurred, as if your mouth is not moving properly. In other cases, you may speak clearly, but what you're saying doesn't make sense. Now, this can be a very unsettling experience, because it affects something we rely on every day, communication. You may feel aware that something is wrong, but unable to correct it in the moment. Others around you may notice it even more quickly. They may see that your words are unclear, or that you're having trouble understanding what's being said to you. Now, this is an important point. Stroke doesn't just affect movement. It can also affect how the brain processes language. There are specific areas of the brain responsible for speaking, understanding, and organizing thoughts. If blood flow to these areas is disrupted, it can interfere with your ability to communicate. And just like the previous symptom, this can happen suddenly. One moment, everything feels normal. The next, something feels off. You may lose your train of thought. You may struggle to follow a simple conversation. Or you may find it difficult to respond clearly. Now, here's where many people make another mistake. They assume it's fatigue, or stress, or simply a moment of forgetfulness. And while those can sometimes affect communication, sudden and noticeable changes should never be dismissed, especially if they come on quickly. Another important thing to watch for is understanding. If someone speaks to you and you suddenly find it difficult to understand what they're saying, that is also a warning sign. It's not just about speaking, it's also about processing information. The key takeaway here is this. If you or someone around you suddenly has trouble speaking, forming words, or understanding simple communication, do not ignore it. Because these changes may be your brain signaling that something serious is happening. And recognizing that signal early can make all the difference. Vision problems, blurred or double vision. Another early warning sign that is often overlooked is a sudden change in vision. Now, this doesn't always mean complete loss of sight. In many cases, it begins more subtly. You might notice that your vision becomes blurred, or that objects appear doubled. In some situations, you may lose vision in one eye, or in part of your visual field, without any pain at all. And that's what makes it easy to ignore. Because there's no discomfort, you might assume it's just temporary. Perhaps you think your eyes are tired, or that it's simply part of getting older. But here's what's important to understand. Your vision is closely connected to your brain. Different areas of the brain are responsible for processing what you see. When blood flow to those areas is disrupted, it can affect how visual information is received and interpreted. This is why vision changes can be an early sign of a stroke. Now, one of the key features of this symptom is how suddenly it appears. You may be reading, watching television, or going about your day, and then something changes. Your vision becomes unclear. You may struggle to focus, or you may feel like part of your field of vision is missing. Some people describe it as a shadow or dark area. Others may notice that they can't see clearly out of one side. In some cases, this can affect balance as well. Because your vision helps guide your movement, a sudden change can make you feel unsteady or unsure. Now, it's important to pay attention to how quickly this happens. Gradual vision changes are often related to eye health, but sudden changes, especially when they occur without warning, should be taken seriously. Even if the symptom lasts only a short time, even if it improves on its own. Because temporary symptoms can still be a warning sign of something more serious. The key takeaway here is this. If your vision suddenly changes, whether it's blurred, doubled, or partially lost, do not ignore it. Because your brain may be signaling that it is not receiving the blood flow it needs. And recognizing that signal early can make a critical difference. Dizziness or loss of balance. Another early sign that can easily be dismissed is sudden dizziness or a loss of balance. Now, many people experience dizziness from time to time. It can happen when you stand up too quickly or when you feel tired or dehydrated. But the type of dizziness associated with a stroke is often different. It tends to come on suddenly, and it may be accompanied by a feeling that something is not quite right. You may feel unsteady on your feet. You may find it difficult to walk in a straight line. Or you may feel like the room is spinning, even when you're standing still. In some cases, this can be accompanied by a loss of coordination. Simple movements, such as reaching for an object or turning your head, may feel less controlled. Now, this happens because certain areas of the brain are responsible for balance and coordination. When blood flow to those areas is disrupted, it can interfere with how your body maintains stability. And just like the other signs we've discussed, this can happen very quickly. One moment you feel fine, the next you feel off balance. Now, here's where many people make a mistake. They assume it's something minor, perhaps low blood pressure, or a brief moment of fatigue. And while those can cause dizziness, sudden and unexplained loss of balance should not be ignored, especially if it is severe or comes without a clear cause. Another important point is how this affects your movement. If you feel unsteady, you may take shorter steps. You may hold on to objects for support, or you may avoid moving altogether. These are signs that your body is trying to compensate for a loss of control. Now, it's also important to consider whether this symptom appears alongside others. For example, dizziness combined with vision changes or weakness can be especially significant. The key takeaway here is this: sudden dizziness or loss of balance is not always harmless. It can be a signal that the part of your brain responsible for coordination is being affected. And when that happens, it's important to take it seriously, because early recognition can make a critical difference in how the situation is handled. Sudden severe headache. Another warning sign that should never be ignored is a sudden severe headache, especially if it feels different from anything you've experienced before. Now, not all headaches are serious. Many people experience headaches due to stress, tension, dehydration, or lack of sleep. But the type of headache associated with a stroke is often described in a very specific way. It comes on suddenly, and it can feel intense. Some people describe it as the worst headache they've ever had. Others say it feels sharp, overwhelming, or unlike any previous headache. Now, what makes this particularly important is the speed at which it appears. You may feel completely fine one moment, and then suddenly, without warning, the headache begins. There may be no clear trigger, no gradual buildup, just a rapid onset of discomfort. Now, in some cases, this type of headache may be accompanied by other symptoms. For example, nausea or vomiting, sensitivity to light, confusion, or difficulty focusing. These additional signs can make the situation even more concerning. So why does this happen? In certain types of stroke, such as those involving bleeding in the brain, pressure can build quickly. This sudden change can trigger a severe headache. Now, it's important to understand that not every severe headache is a stroke. But when a headache appears suddenly, intensely, and without a clear reason, it should be taken seriously, especially if it feels different from your usual experience. Another key point is familiarity. Most people know what their typical headaches feel like, so when something feels unusual, stronger, faster, or more intense, that difference matters. Now, here's where many people make a mistake. They try to wait it out. They assume it will pass, or they take something for pain and hope it improves. But when it comes to sudden and severe symptoms, waiting can be risky. Because if it is related to a stroke, time plays a critical role in treatment. The key takeaway here is this: if you experience a sudden, intense headache that feels different from anything you've had before, do not ignore it, because your body may be signaling something serious. And recognizing that signal early can make all the difference. Difficulty understanding speech. Another important, and often confusing, early sign of a stroke is difficulty understanding speech. Now, this is different from trouble speaking. In this case, the issue is not what you say, but what you hear and process. Someone may be speaking clearly to you, but you suddenly find it difficult to understand what they're saying. Their words may sound unclear, jumbled, or hard to follow. In some cases, it may feel like you're hearing the words, but they don't make sense. This can be a very unsettling experience, because it affects your ability to communicate and respond. You may feel confused. You may struggle to keep up with a conversation. Or you may find yourself unable to respond appropriately. Now, this happens because certain areas of the brain are responsible for processing language. When blood flow to these areas is disrupted, it can interfere with how your brain interprets what you hear. And just like the other symptoms we've discussed, this can happen suddenly. One moment, everything feels normal. The next, something feels off. You may pause more often. You may ask people to repeat themselves. Or you may simply feel lost in the conversation. Now, here's something important to keep in mind. This symptom can sometimes be mistaken for distraction or fatigue. You might think you're just tired or not paying attention. But sudden difficulty understanding simple speech, especially when it's noticeable, should not be ignored. Another key sign is how quickly it appears. Gradual changes in hearing or comprehension may have different causes, but sudden changes are more concerning. It's also important to consider whether this happens alongside other symptoms. For example, confusion combined with weakness, vision changes, or dizziness can be especially significant. The key takeaway here is this: if you suddenly have trouble understanding what others are saying, even if they're speaking clearly, take it seriously, because your brain may be struggling to process information the way it normally does. And recognizing that change early can make a critical difference in how quickly you respond. Sudden weakness or loss of coordination. The final early warning sign, and one that is closely related to several we've already discussed, is sudden weakness or a loss of coordination. Now, this can sometimes overlap with numbness or balance issues, but here the focus is on how well your body responds to movement. You may notice that simple actions suddenly feel more difficult. For example, lifting an object may feel harder than usual, walking may feel unsteady, or your movements may seem less controlled. In some cases, you may feel like your body is not responding the way it normally does. Your hand may feel clumsy, your grip may weaken, or your steps may feel uneven. Now, this can happen very quickly. One moment, everything feels normal. The next, your body feels slightly off. And because the change can be subtle at first, it's easy to ignore. You might assume it's fatigue, or that you simply need to rest. But here's what's important to understand. Coordination is controlled by specific areas of the brain. When those areas are affected, even slightly, it can interfere with how your body moves and responds. This is why movements may feel slower, less precise, or harder to control. Another important sign is how your body reacts to everyday tasks. If you find yourself dropping objects, missing steps, or struggling with movements that were once easy, that change matters. Now, this doesn't mean every moment of weakness is serious, but sudden and unexplained changes should never be ignored, especially when they appear alongside other symptoms we've discussed. Because in many cases, the body does not send just one signal. It sends multiple. And when those signals are recognized together, they provide a clearer picture of what may be happening. The key takeaway here is this. If your body suddenly feels weaker, less coordinated, or harder to control, pay attention, because that change may be your brain signaling that something is not right. And recognizing that signal early can make a life-saving difference. As we come to the end of this video, take a moment to reflect on what we've covered. Stroke does not always begin with something obvious or dramatic. In many cases, it starts with small, subtle changes. Changes that are easy to overlook, easy to explain away, or easy to ignore. But as you've seen, those small signals can be very important. From sudden numbness, to changes in speech or understanding, to vision problems, dizziness, or unusual headaches. Each of these signs is your body's way of communicating with you. Now, the goal is not to create fear, but also not to ignore what your body is telling you. Because when it comes to stroke, time matters. Recognizing the signs early and acting on them can make a significant difference. It can affect not only recovery, but overall quality of life. So the next time something feels different, sudden, or unusual, take it seriously. You don't need to have all the answers, but paying attention is the first step. If you found this video helpful, stay with me. There's always more to learn when it comes to protecting your health and staying independent as you age. And sometimes, the smallest signs can tell you the most.